You're watching GTV Breakfast. Still to come, 7 o'clock, sports news. And then right after the sports, our brand new segment, Social Media Corner, SMC, to be hosted by Valerie. All right, so now we're talking about the prevalence of allergic diseases worldwide that's rising dramatically in both developed and developing countries. A steady increase in the prevalence of these allergic diseases globally has occurred, with about 30 to 40% of the world's population now being affected by one or more allergic conditions such as eczema, drug, food and insect allergies, and many, many, many more. According to the World Health Organization statistics, hundreds of millions of subjects in the world suffer from rhinitis, and more than 300 million have asthma, affecting the quality of life of these individuals and their families, and negatively impacting socioeconomic welfare of the people in society. Educating us this morning how we can manage these allergies and avoid the triggers is Dr. Ernest Enim Opari. He's a specialist family physician at Kolebu Teaching Hospital. Ernest, good morning. How are you doing, man?
Fine. Good morning, Mr. Day, and good morning to our viewers this morning.
We're good. You just call me Kafi. And we're good to go, man. What's up?
Very well.
How are things?
Cool. How was your weekend?
It was good. Palm Sunday, procession, and then a little concert in the evening. I was all right. How was yours?
Arsenal winning was okay for me.
Oh, okay. You're an Arsenal man.
Because of party.
Because of party. Why not? Yeah, people supported Chelsea because of Essien, so why not? Yeah, he's doing great things.
It's our time.
Yes, I think you guys are going to win this year.
Hopefully.
Yeah. Unless an allergy attacks you.
Hopefully not.
Listen, tell us, break it out for a 9-year-old who's watching you right now on his Easter break. What are allergies?
So generally, allergies refer to an exaggerated response by a part of the human system called the humoral system. So ideally, when the body encounters any foreign object or foreign substance, it tends to respond to it in anticipation that whatever that is encountering is foreign and hence dangerous.
Okay.
But many a time you could have a situation where, because of a certain predisposition in the person's family, and whether there's a family history or due to a non-prior exposure, the body mounts an exaggerated response to this foreign substance, which may not be harmful. So that is the catch. Okay. So the response is exaggerated because, one, it may be new to the system, and secondly, it could be that the substance itself or body that the system is reacting to may not even be harmful, but the body interprets it to be harmful, and hence the exaggerated response compared to what the body is actually dealing with.
Okay, so it's like the body sees the stuff coming in as an invader.
Yes.
And trying to protect you.
Yes, protect you, the individual.
Okay, what are the common types of allergies that we face?
The common ones that we have, it could affect the eyes, it could affect the nose. You could also affect the skin. So like you mentioned in the preamble, so if it affects the nose, you call it the allergic rhinitis. If it affects the skin, it's usually character. Maybe later we'll go into the description, but you can call it atopic dermatitis or contact dermatitis. Okay. A few times you can have it affect the eyes, and that becomes allergic conjunctivitis. So it can affect almost every part of your body, but these are the common presentations: the eye, the nose, the skin. And I just quickly have to add that even though it may sound simple, as the discussion goes on, we will realize that even as the exposure increases, or sometimes as the exaggerated response or the allergic response goes on, it may have other systemic effects. So even though I said it can affect the nose, the skin, and the eyes, sometimes your body gives so much response that it goes ahead to affect how you breathe. It affects how your blood system works. That's the circulatory system. So your blood pressure may come down, in which case we are describing not just the allergy, but we call anaphylaxis. That's the case where you have a certain skin or mucosal involvement that is characterized by either a compromise in your respiratory system, a compromise in your gastrointestinal system, that anything that has to do with your swallowing, digestive system, and sometimes can even go ahead and affect how you breathe. So these are the things that we should know basically about allergies. I have
a friend who, anytime she eats pineapple, then she gets some crazy reaction.
Yes, that's a flare. Yes. Okay. Yes. So it can happen. Example. So many people say, okay, what makes people? They are common things, but that's not to say that there are particular things that will run across. Somebody, like you said, pineapple in itself is not bad. It has all the nutrients. But if you realize that this is something that you react to, then later we'll talk about the management. You may have to avoid it. Not because the pineapple is bad, but for you, your body tends your reaction to the pineapple is not good.
Okay.
Good enough.
How do you know if you have an allergy?
So, like you just pointed out now, so based on the history, so somebody can tell you that I have realized that when I take this substance or when I'm exposed to this particular substance, it could be high-scented perfume, it could be pollen, it could be dust. People say, oh, this is weekend, I want to just clean my room, and anytime I start dusting my windows or my cupboard or anything, I begin to sneeze, I have this unwellness, I have this scratch, or when I put on this particular clothing, it could be jeans, it could be a particular fabric. Whenever I put it on, I realize that there are some rashes on my body. So the first thing is the history from the person involved. They tend to associate some prior exposures to the experience that they are having. The other level that you can look at in trying to diagnose it is a family history. That's not to say everybody who has that family history would have an allergy. But for instance, if a parent, you said the children are back from school, so they are watching this program. So if you're a child watching the program and your mom says, oh, I used to have asthma when I was in school. Anytime I was in school, every time we went for maybe physical education and we went to the field, I had difficulty in breathing. Whenever you are dusting the room, they complain of difficulty in breathing, you are at an increased risk. It means that you have a tendency we call atopy, which is more like there's an allergy, there's a family history of allergy, and it increases the predisposition of it happening in that particular individual. So basically, it could be based on experience in terms of an individual having that encounter, or it could be based on a family history of that incident, as in somebody with a relative, a close relative who has a similar presentation.
Okay, so let's go through some of the things that can trigger allergies. You mentioned some of them. Yes. Foods. Potentially, can any kind of food cause an allergy in you, depending on who you are?
Yes, so potentially. So the broad categories, you can have foods as one of them. Sometimes you could have also things that we take, medications. Okay. So some medications, people react differently. And the catch about that one is that sometimes you can have somebody take particular medications over time, and all of a sudden the body decides to. It's common. So I remember one time one of our patients was on an antihypertensive. That's a medication given to control hypertension, and has been on it for a long time. One time the person just takes it, and then the mouth became swollen around the lips. Wow. So quickly rushed to the hospital, which was very good. And then we looked at it. He hadn't been exposed to anything other than what he was taking. So we went ahead to look at his drug history, and we realized that it was one of the antihypertensives. That's not to say don't take your blood pressure medication, but I'm just saying it can happen. So
how do you help that person?
So in that case, the quick thing we have to do is that we have to manage as an emergency, because when you have swelling of the mouth and around the tongue, it could affect your breathing. Yeah. So we asked whether, of course, he was communicating, because if you're able to communicate, it means that your airway is okay, and he was breathing normally, the blood pressure was okay. So immediately we gave some medication to make sure that we control the swelling or the exaggerated response. So we give medication in that case. This medication, I mean, it's not too common in our part of the world, but it's something that our people should know. It's called epinephrine. So you don't have to give it every time. So if you know you have an allergy as you are traveling, like people who have diabetes travel with, if they are on insulin, they have their insulin bag, they have maybe a pack of sugary substance to make sure that they don't run into low blood sugar, which is referred to as hypoglycemia. So people who are well known to have allergies and have a higher risk of having what I have described as anaphylaxis, they have this drug that they carry along as an emergency drug. So whenever they start experiencing it, because like I said, it's a spectrum. The simple ones are what, in quote, we call the simple rash, simple sneezing, but you can have an exaggerated response where the blood pressure drops significantly, more than 30% of a person's baseline. So in that case, when they come in and you check the airway, you check their breathing, you check their blood pressure, and they are fine, you give this medication, and then the way the medicine works is that when you have this exaggerated response, to decrease or open up your blood vessels. So instead of the constriction allowing your blood pressure and your breathing to be ongoing, it pulls the blood in the system, so your blood pressure just drops. So this medication we give is supposed to allow the circulatory system to constrict, so the blood vessels constrict to increase the outflow to other organs of the body. So it's one way of dealing with it, but more so, I believe that this program is also supposed to educate us about the avoidance. So if you're an individual and you already know particular stuff that bring this condition on, you'd have to avoid it. There's no gain trying to see if it will disappear, as it were, because you're an individual. Usually it's idiosyncratic, so people can react to very basic stuff, apart from the creams that they use that may have particular components that they don't find very well. The cream may be good, it has nothing bad, but you may be reacting to it. The clothes may be nice, but it has something that you are reacting to. It can be a necklace, it can be something that you are wearing that seems to bring it on. So it could be in the foods, it could be in the medication, it could be something that has direct contact. And sometimes you have little to do about it, the environment. So you enter an environment that's quite moldy, you have maybe some dust, the air conditioning, smoke, and it's not your fault.
I shook someone in, and then for 1 week I couldn't stop sneezing because the person had so much perfume on him.
Exactly.
Yeah.
So, I mean, that's no fault of yours.
No.
That's no fault of yours. But that is the case where you have allergic rhinitis, because usually the characteristic thing has to do with the sneezing, the cough, which is uncontrollable, especially following an exposure to an allergen, as it were.
Okay. So, in your practice, which are the most common types of triggers for allergies?
So, like you mentioned, usually the change in weather, when the weather suddenly becomes colder, people with these allergies come. When it's very dry and dusty, people come. High scented perfumes tend to bring people to the hospital because of allergic rhinitis. The other thing is that exercise is important, but research has shown that so there are gradations of exercise. So moderate intensity exercise is protective, but if you have a predisposition to allergies, as it were, and you play in a dusty environment and the intensity is high intensity, that tends to trigger it. That's not to say that the exercise is the cause, but you are exposed to this particular allergen in a very high tempo or high intensity setting, and so your body reacts to it adversely. So off the top of my head and based on my practice, these are the top three. So you would come with allergies with regards to the nose when you're either exposed to a foreign substance like a perfume or dust or smoke, or there's some high intensity activity that has precipitated it in the midst of everything.
What's the strangest trigger for an allergy that you have encountered?
Think I can't tell. It's a food, and let me say that I heard that I'm not the one who saw, so I heard about it. That a family went for, I don't know whether it was a family gathering or something. Then they ordered for food. It was supposed to be celebratory, and then everybody ordered. They didn't know, of course. One of them took seafood, and then something was supposed to be merrymaking. The person took the seafood and then was rushed to the hospital. They obviously didn't know that was it, but the person found some instant or almost instant swelling of the mouth, difficulty in breathing, and of course, based on the trajectory or the narrative of the incident, you could tell it was related to an allergy, and so the situation was solved. I didn't see the patient, but I was told about it. That was striking because you are going to a party. There's seafood. You want to just try. It's merrymaking, and then the party turns south. So that's the, in quote, most dramatic experience I've heard about when it comes to allergies.
It can be that acute?
Yes, it can be acute.
You take it and then boom.
It can, exactly. And it's almost like your body is telling you, I don't like this thing. And the narrative will tell you that the person was fine. They started eating, and maybe starts with an itch around the mouth. Now the mouth is becoming big. Now they cannot breathe. Then boom, you have to send to the hospital. It can be very quick. Even though some take time, like the ones on the skin, maybe you itch, you see the rash today. It's almost like it's subsiding, and then it just comes back. So that's the most dramatic I have heard about. I have not seen one apart from the person who had hypertension, who was taking his regular medication, and then one day took it and then had a side effect, as it were.
Can an allergy kill you?
Based on what I said, the severity, if an allergy continues in terms of severity and leads to what we call anaphylaxis, where it is not just restricted to the skin or the mucosa and affects your breathing because the airway is blocked based on the swelling, which we call edema in the airway, or it affects your circulatory system or the cardiovascular system such that your heart is not supposed to pump as much as it can, then the medical term is called what we call, it can lead to shock, not the shock that we have in terms of surprise or emotional shock, but biological shock, in the sense that now your body cannot meet your heart cannot meet the requirement of the body in terms of the amount of blood that it needs, and then your body can just shut down. Wow. That's why it's important for us to pay attention to this topic this morning.
What should you do if you are confronted with somebody who appears to have a serious reaction?
So immediately on the site, you just have to check whether, we call it the simple resuscitation methods, the ABC. So airway, as I'm conversing with you now. So if I ask you, okay, I'm just assuming you took water and then all of a sudden, so Kafi cannot breathe.
Yes.
Kafi, what is wrong with you? You say, I think I'm fine, something like that. And I realize that there are some rashes here. So the first thing I have to do, if you're able to engage me by talking, it means that your airway is patent and open. Then I go ahead and then just listen to your chest and find out if you are breathing normally, find out if everything is fine. And then I check your blood pressure. If any of this is fine, then I have to rush you to a nearby hospital. If I realize that your airway is blocked, then you have to be positioned in a way such that your tongue is not rolled back.
Because so what position is that? I have to sit up?
Yes.
Sit up?
Yes.
Okay.
Yes. I mean, if you can even lie down, because it's an emergency, so you're lying down and then your head is tilted in such a way that your tongue doesn't roll back to obstruct your airway. And then if that is assured, like I said, so it's a sequence. So as you are checking, you find out whether the person is able to breathe. Because if the person is not breathing, then it's also an indication that the thing has gone beyond just the exposure to the allergy. In that case, it may even trigger a CPR or a cardiopulmonary resuscitation. So it is not that simple. It may be a simple trigger, but the effect may be cascading in other systems of the body.
So what's that ABC you are talking
so
about?
The A is the airway. You are conversing with the person. The person has taken a substance, has just eaten, and all of a sudden they can't breathe. So can the person engage you? Can the person talk? If the person is talking, that means that the airway is patent. If the person is not talking or able to tell you, that could be edema. So immediately you position the person so that the tongue is not rolled back, because the tongue rolling back will worsen the breathing. So that's the A. The B is the breathing. You can, of course, see the chest move up and down if the person is breathing normally. But if the person is breathing that way, you are good. If the person is not, it means that there is something wrong with the breathing, and that indirectly may lead to some shutdown in the cardiovascular system. So if the person is not, you check the pulse, then you may have to start your compression. But if the person is breathing, sometimes what you realize that they may be breathing, but the number of times they are breathing is either slow, too fast, or characterized by an unusual noise. So the person may be breathing, but allow me. So you hear some sound. So like it's also kind of snoring or disgruntled, or like some foreign body. So it's telling you that the person is breathing, but something is not exactly. So that should also point to you. And then the circulation, just check the pulse. If the pulse is weak, thready, or you can't even feel it, then you just have to go to your CPR at that moment. And like I said, the CPR is not supposed to be all in all. When you initiate that one, someone else, you call for help. Someone else is calling for an ambulance, or you get a car to send to the nearest hospital. Because like I said, the ideal management is to give this medication called the epinephrine, which tends to help in terms of the breathing, the circulation and everything, and also reverses the ongoing response to the allergen as it were.
Okay, so airways, breathing,
and circulation.
Yes. The ABCs
of
dealing with allergies and avoiding triggers. In case you just joined us, this is the first working day of the new month, and I'm here with Dr. Ernest Enim Opari, and we are looking at managing allergies and avoiding triggers. A couple of messages have come in. Our number is 055-556-1034. Thelma will read the messages and the doctor will respond. Welcome to the BFS clinic. Ago.
Ame, Cap, how are you?
Shoot for me.
You're still in heritage mood.
Every day is Heritage Day.
Every day.
Yes.
Every single day is Heritage Day.
Including Coffee Day.
I think that for allergies, a lot of the food we eat have a lot of influence on that. I think the screen is not responding.
I think it's allergic to your pointer.
I'm allergic to it not responding. So I want the screen to be responsive. But Doc, I wonder, when you have food allergies, is it better to try? People say, oh, if you eat it a few more times, you'll be fine. But then if you avoid it, never get over it. Is that the scientific response?
So based on general, anytime you are giving an advice like that, you are looking at what benefits a general pool. There may be a few people who would come off better when they are exposed to it constantly, because the thinking is that as you have increased exposure to those substances, your body tends to tone down on their response. But there is the vice versa, where people tend to mount an increased response to things that they are already allergic to. So my advice is that if you ever have an exposure to a particular food, then you are supposed to avoid it. It may be something, a delicacy, maybe nuts, fish foods, like we said, pineapple. But if you know that you are allergic to it, I would recommend that you stay away and probably find a substitute.
Some people don't even think Africans have allergies to begin with, so that's also something to consider.
You haven't met me.
Alhaji Dauda is asking about hiccups and whether they could be a sign of an allergic reaction to something.
Not direct by medicine, we say you never say never. It could be. So if they are characterized by other stuff, like maybe a rash and an increased exposure to, it comes after an exposure to something, I'll say it's an allergy. But there are other things that could cause hiccups. It could be something in the abdomen. I've seen a patient like that who had hiccups and maybe assumed there was an allergy. Unfortunately, it turned out to be a tumor in the abdomen. Ooh. So, sometimes when these questions are asked, it has to be placed in context so that people don't easily say, I have a hiccup, it's an allergy. And they stay home for, yes. So, let's just be careful. It could be an allergy, but if it's not too sure, I think he should come to the hospital.
Okay, more on the screen. Good morning, CAF. Contributions. In acute allergic reaction with respiratory distress, apart from, this Charlie. Adrenaline, Olivers. I don't even know what Olivers is trying to say.
Read it to us again. In acute allergic reaction.
In acute allergic reaction with respiratory distress, apart from this one, I can't say it.
Epinephrine.
Yes. We can also administer adrenaline 1 mg over 1 m Olivers.
Yeah. Yes. So he's talking about the treatment. I think he may be a doctor. Yes. So right. He's not wrong.
You see, doctors, when they are writing, you can't read their handwriting, even when they are typing.
Interesting.
Just make it simple so that we are also educated. Today's topic is very educative. Thank you. Justice Insurer, Ancient Media. What's the difference between asthma and bronchitis? For me, the scariest treatment is the intravenous injection. I always stand around nurses when it is being administered to my children. Look away is my advice. I do have allergies to paracetamol and Doc, what is this? What else can I take for headaches?
So the NSAIDs is mnemonic. So the N stands for non, the S for steroids, and A anti-inflammatory. So non-steroidal anti-inflammatory drugs. So it says, what else can I take for headaches, please? So it's important that the person has identified the allergy, which is the para and then other NSAIDs. There are other forms of painkillers, so I don't need to say it on air, but there's always an option, just to be sure.
Okay. Good morning, CAF. Please ask the doctor, can someone develop asthma as he or she ages? FO is asking from North Legon. Gavivina.
Money sweet.
Okay. I like that name. And then the one on the screen now, what are the fundamental groups or signals that may lead to allergies? And what are the many factors that... Aaron, traditional methods of preventing allergies, are there any?
When I was young, people gave different stuff, and I've read also online. But the main thing, even medically, what I've mentioned so far has to do with the treatment of the complication. But the main way to deal with allergies is avoiding the allergy. That's all.
Avoid the allergy. Perhaps the last one, why are allergies on increase? Doc,
so there are two sides of this. It could be because of the reportage. And usually that's one dynamic that has to do with public health. So like we are talking about this morning, all of a sudden people are texting in and they're saying I have an allergy. So it may appear that there's an increase, but they may have been in the community already. The other thing is that perhaps we have more industrialization and we have more smoke and other toxic chemicals coming about, and so people are now being exposed to things that they didn't know they would have reacted to. So these are the two that I can allude to.
Okay, thank you, Doc.
Thank you very much. I'm definitely not allergic to you. Come back again.
I will do.
In terms of men, women, children, what does the literature say about who tends to get allergies?
Literature is very interesting when it comes to the predilection with regards to gender. So before puberty, either because boys are more experimentative, they tend to have more allergies before puberty. During young age, woman, young man, there tends to be a shift to the women. because of the type of activities that they engage in. Because if you are looking at food allergies, the women are cooking, men will also get to do other stuff, and then there is a hormonal component. So research has shown that the testosterone, which is predominantly the male hormone, is protective, whereas the estrogen, which is predominantly the female hormone, tends not to be protective. So as you are aging, in your young before puberty, boys tend to have it, they are sneezing and everything. As we grow, the women tend to have it more. And then at menopause, when everything is declining in terms of the hormones, it tends to be a little equal. So there's this, it's not all through, depending on the age, then there is some increase in one gender or the other.
Okay. I think there are two more questions. I'm going to just dash over to the board and read them, and then we'll wrap this up. Okay. So, Shiraba, not talking about allergies, he's talking about politics. Anytime I eat 2-day-old groundnut soup, I feel pains in my stomach. Can I say groundnut soup is my allergy? That's the best kind of groundnut soup. For me, I love groundnut soup. The thicker, the better. Yeah, but hey, is he allergic to groundnut soup?
He's 2 days. 2 days old. So it's not too clear. Does it mean
it was on the day, on Saturday and then
so if it doesn't happen on the day and just stomach pain is not enough.
Okay.
It has to be other things. So they may be running in terms of having a diarrhea. They may be having abdominal cramps. So it could be, but it's the 2 days plus the stomach pain that is making it inadequate for me to diagnose. Yeah, okay. But usually it's per exposure. So for some people, the thing is that it may not actually be 2 days. It may be on the day that you took it, but it could be a delayed reaction to it. Because it could be, apart from me saying it could be instant, there are few instances where you can have what we call biphasic allergic reaction, where it looks as though the reaction is subsided, and then without any exposure, there is the same response. So you took something today that you are allergic to, and then you had an immediate response. Okay, I'm not going to take it anymore. Your body seems to have settled everything. And then maybe 6 days after, you have an allergic response without any exposure, which you call biphasic. So between when you had the first and the second, there's not been another exposure, but then you tend to have another response. So it could be, but I need more details.
All right. So Saida from Tamale wants to know, how about headaches from milk products?
Again, it's not that clear. I have to look at other things. How long have you been exposed to this? What other things do you come with? Because you could have issues with a product which is not allergy. You can have an adverse effect. Drugs, you can take some medications and we say, be careful because this particular medication has side effects like diarrhea, has side effects like cough. It may not be an allergy, but it's a side effect. So sometimes your body may be reacting adversely to it. The milk product, you have a headache. I cannot really describe it as an allergy except if I have other details.
So those who are lactose intolerant, those who can't take milk products,
yes,
are they allergic to milk?
It is a form of allergy. So allergy is put in a spectrum called hypersensitivity. Okay. So there's hypersensitivity type 1, type 2, type 3, type 4. Okay. So it is a form of allergy in itself.
All right, back to the board. Why do doctors continue to administer the intravenous injection when they know it kills if not properly administered by a good nurse? Does it kill?
So no. The intravenous injection in itself is a mode or a mode of administration. So you're either giving the medication or the product orally through injection or through another means. So the mode of administration cannot kill, and so it depends on what is being given, and no doctor will give anything else. I think the question has come again. The question about asthma and bronchitis.
Yes, what's the difference between asthma and bronchitis?
Asthma in the sphere of allergies is another form of allergic response that has to do with the respiratory system. Bronchitis has to do specifically to the airway. So there is chronic cough, there is difficulty in breathing sometimes, and it could be in people who are exposed to smoke or people who are exposed to other exposures, maybe like the dust and other things. So that the little difference is that when somebody has bronchitis and you listen to the chest, you may or may not find any clinical signs. Okay. But with asthma, it is characterized by a sign which we call wheezing. Okay. So you listen to the chest and then you hear some sound which you call rhonchi.
Alrighty. Good morning, doctor. I used to eat pineapples. All of a sudden, I'm now allergic to pineapples. What may be the cause?
So, like we said in the introduction, it is possible to have been exposed to something in the past and you didn't have any reaction, and then now you have a reaction because the body has modified its response to the same ingredient.
Okay. And, Doc, can I use Piriton medical tablets for allergies from Allergy Dawood and Madina Estate?
Yes, you can. It can be used, but please don't. I think that because you can use it in the interim,
Okay.
but you need to still see a doctor to have a full or thorough assessment.
Give us a 30-second answer. When is allergic rhinitis most prevalent?
I think when the weather changes, usually in the dry season, usually.
Okay. All right. What's your 30-second takeaway?
So 30-second is, if you're exposed to a substance and you tend to react to it, please take note, have a book, a diary, and you document those particular things that lead on to the allergies and try and avoid them.
It's been a real pleasure talking to you.
Thank you very much.
Dr. Ernest Enimopare is a specialist family physician at Kolebu Teaching Hospital. You can find this conversation again on our blue tick verified Facebook platform, GTV Ghana. Yeah, I had to say it. And then in case you don't get to watch it, in the evening, let's say 11:30 in the night, 11:30, those of you on night duty, you can go to Facebook, you can go to GTV Ghana on DSTV channel 278 or just on GTV, and you can find the playback of this conversation. Share it on GTV platform so a lot of people get to know on Facebook about this particular conversation on managing allergies and avoiding triggers. Still to come, I'm not avoiding the news in the sports. Neither am I avoiding the social media corner, which is a brand new segment to be hosted by Valerie. And then we have conversations on what's happening in the news. My guests are Professor Daniel Bruce, the clinical psychologist, and the corporate governance expert and lecturer and lawyer and journalist, Dr. Anani Jinde. Parliament has passed 3 revenue bills. What's the fuss? You will find out and get all the details, all the juice right here. And we have a 9-year-old author. There's a lot on this show. You stick around. Maltiti comes up next with the sports. Good morning.